Yeah, hello and welcome to Women Cardiac Care Conference 2026 here in Indore. Organized by WINCAS, that is Women in Cardiology and Related Sciences, this meeting brings together leading cardiologists from across India and around the world to advance research and clinical care in women's cardiovascular health. I'm Dr. Neeta Keertane and I'm joined here by a name that needs no introduction, Dr. Sarita Rao ma'am. She is the president of WINCARS and also a co-chair at EAPCI International Affairs. So, a warm welcome, ma'am, here today, and thank you for joining us. It's our privilege and honor to interview you here. And, ma'am, I just wanted to ask you a very pertinent question regarding that. Despite there is a growing awareness of cardiovascular disease in diseases, but the cardiovascular disease awareness in women remains underdiagnosed, okay, and undertreated worldwide. So, can you just highlight what are the key gaps WINCAS aim to address in the coming years?
Thank you, Dr. Neeta. When we talk about CVD in women, so yes, it is underdiagnosed, undertreated, and first of all, why is it underdiagnosed? It's underdiagnosed because it doesn't present in the same way that it presents in men. So women have typically a different presentation, which is quite normal for them. They present more with fatigue, unexplained discomfort. It doesn't necessarily have to be chest discomfort. They complain of a weakness, a tiredness. So they present in very, or sometimes just breathlessness. So they present in very different ways. Second is that the people around them don't take it so seriously. They generally tend to think that maybe it's anxiety or maybe it's just that they are fatigued with the housework or looking after children. And studies have shown that when women have a heart attack, they reach the hospital much later as compared to when a male counterpart has a heart attack. So their symptoms are a little different and it's a little difficult to pick in them. The second is that women by nature are very sacrificing. So they delay telling others about their problems till it gets really bad. The third is that the people around them need to take them very seriously. When a woman complains, it's usually something serious because she doesn't complain easy. And so that's why it's underdiagnosed. Fourth is that women is not economically in India. Women are not economically independent, so they are dependent upon the male counterpart to take them to the hospital or to a doctor. So you can say, not having economic independence is also one of the factors that women get into the hospital much later, and it gets diagnosed so much later. Now, undertreated again, for undertreatment, once a woman has CVD and has had a heart attack, the treatment typically in a country like ours, where patients have to pay for their treatment, again is strongly dependent on the fact that whether women is economically independent in being able to afford that treatment. It's really sad, but it takes minutes for a family to decide when a man has a heart attack to go ahead and get an angiogram done, but it takes hours, sometimes days, when a woman has a heart attack, for the family to decide that this woman needs an angiogram. So, economic independence again. Second is for women to get treatment, it's also very important that they are educated enough to realize what are the things that they require. We still have a very huge amount of a rural population, and typically, when we start medication in them, they go away. Maybe they come back once and then they're just lost to follow up. So, people have to understand that once you have heart disease, you probably need to take medication for lifelong. So, underdiagnosed, undertreated, yes, this is the situation of our country and in many other countries around the world when it comes to women.
Very, very well put, ma'am. You've covered all the aspects, undertreated also, underdiagnosed also, all these aspects, and also since you said that they are economically also not independent. So, ma'am, I think what I gathered from this conversation is that awareness. There's a lot of awareness, lack of awareness in this area. So, ma'am, what is does Wincar aiming to address this aspect also in coming years?
So, Vincas has been working on women's cardiovascular health for a long time. For the longest time ever, people thought that, a woman needs to get treated the same way that a man does. If you look at all the studies and the clinical trials which have occurred, the representation of women in them was hardly 5, 10, 15, 20, maximum 25%. So it was automatically assumed that what works for a man will work for a woman. It's not necessarily so. Why? Because women are physiologically different. Uh, a woman has certain changes in her body and in her lifetime which doesn't happen with a man. For example, women bear children, so they have things like they do breastfeeding. So, and they have during pregnancy, they have gestational hypertension, gestational diabetes. Women suffer from breast cancer, women suffer from cervical cancer, all kinds of issues. And women have traditionally huge shifts during menopause, after which the CVD risk rises. So, women are physiologically different from men, and there are many things, and women have a very high incidence of microvascular disease in the heart, which typically shows normal coronaries, no blockages, but women still complain of pain because there's microvascular disease. So, all these things are different in women and they need to be dealt with differently. So, we don't need to generalize. So, women specific diseases are different. And we need to talk about them. We need to understand that women need different treatments. We need to do research on it, right? So there's a lot of research which is going on, and which wincas promotes research by means of our Prajalika scholarship program, and also by the PSS and the Serbia Research Award which we do. So there are many things which we do to promote research in women specific diseases. In addition to that, we have a journal, that is the Indian Journal of Cardiovascular Disease in Women, which publishes only work related to CVD health in women. So, yes, we are looking at many things that we are doing to promote research in women specific diseases so that the treatment of women with cardiovascular disease becomes better.
So there are a lot of good work going on with the Vincas. Also, ma'am, I came to know there's some consensus statement also the Vincas is trying to develop. So can you throw a light on it as well?
So, yes, we have, in fact, very recently, within the last 2 months, published the consensus document on hypertension in women, and also the consensus document in dyslipidemia in women. And probably it is the first document from India which is specific to women, because I would say that 50% of the population is women. Why was this consensus not done earlier?
Correct.
Because, like I said, women are unique. For example, PCOD is something which develops in women a lot in the adolescence, and they struggle from it. And we know that PCOD is associated with higher risk of hypertension, higher risk of insulin resistance, of higher risk of cholesterol. So these are things which needed to be looked into. For example, if you talk about hypertension in a woman, because she undergoes pregnancy, so drugs which are good for men, for example, ACE inhibitors and ARBs are very good for men, young men, but they are not good for women. Because if a woman who's on an ACE on an ARB gets pregnant, there's going to be fetal malformation. The child is going to be born with a defect, and that's not something that we want. So you can't generalize that because ACE ARB are very good for young men, just give it to the women also. You can't do that. In the same way, there are so many medications which need to be adjusted for women differently as compared to men, which is why we thought a pregnancy, pregnancy we call a window of opportunity, because that is the one time which every woman goes to a doctor. So it is a window of opportunity for education of the women, window of opportunity to find out what our numbers are, what's a blood pressure number, cholesterol number, sugar number. It's a window of opportunity to vaccinate. So there's so many things which we think of. But pregnancy is also the time when hypertension sets in, diabetes sets in, your cholesterol goes haywire. These are things which need to be looked at, and a long term management for that lady needs to be decided at that time.
Absolutely, ma'am. Very well put. Also, there's a lot of not a misconception, but it says it's they say that women is protected in her estrogen years, but I think all that is not true when there are multiple comorbidities which are on the rise, cardiometabolic disorders like hypertension, as you rightly said, obesity, PCOS. So, ma'am, we are women need to be, and I think Vincas was started with this in mind that there's underrepresentation of women in the cardiology at at large. But I think it needs a woman to think for a woman patient as well. So I'm really inspired by the way you put it all, that, and I'm sure women's cardiovascular health would definitely improve with, Vinkas coming in full force. Right now also it's going in full force, and future I think there would be, more to add on. So, and in terms of, ma'am, you are a leader in cardiology yourself, and forget about the gender disparity. You're many, you're good than all the men put together in one. Okay, so there's no, I'm not talking here about the gender thing, but you are a leader. So how do you inspire the other young medical students to take up cardiology?
So, cardiology, as such, we've always been discouraged to take cardiology. I myself was discouraged to take it because they said it's a 24 into 7 job. You're a woman, you're going to get married, you're going to have kids, you're going to have old parents to take care of. But I only questioned one thing, that it's also a man who gets married, it's also a man who has a child, it's also a man who has parents. So if it is your passion to do something, don't listen to these things they say. Everything in life is a shared commitment. It's equally your partner's commitment as much as it is yours. So if you have a passion to do cardiology, just go ahead and follow your passion. One. And don't think that all the responsibility of home, household, kids, family is yours alone. Today, it's a shared commitment. One. Second is that you will be discouraged that there is huge radiation issues. Yes, we do work in an environment of radiation, but we do know what are the safety limits and we do know how to protect ourselves. Today, we have advanced radiation protection devices, and in the future of robotic PCI, it's only going to get less. So, don't be worried about the fact that there's radiation. Protect yourself, keep yourself safe. Second, don't be worried that it's going to be too much for me to handle. Nothing is, because women are way more equipped to do multitasking and to deal with things than their male counterparts. If it is your passion, work hard, believe in yourself, and go ahead. The world is yours to conquer.
Wow, thank you so much, ma'am. That was really inspiring, and I'm sure all the audience who are listening to it, they must feel they must have had a lot of takeaways from this conversation. Thank you so much, ma'am, for joining us.
Thank you.